This lecture is going to focus on differentiating some of the drugs that are in the category of protein synthesis inhibitors. We can further subdivide them into drugs that target the 30S ribosomal subunit, and those are aminoglycosides and tetracycline, versus those drugs that target the 50S ribosomal subunit, macrolides, chloramphenicol, clindamycin, linezolid, and the streptogramins. All of these drugs are protein synthesis inhibitors, and what they do is they bind to the prokaryotic ribosome on the mRNA molecules, and they inhibit protein synthesis. In terms of resistance mechanisms, the bacteria can alter the ribosomal binding site, and that will reduce the permeability of these drugs at that site. And this is what this looks like. Here's the bacterial ribosome, and here's the site of mRNA translation and protein synthesis. And so what these drugs do is that they either have specificity to the 50S or the 30S ribosomal subunit, and basically interfere with the ability of these two protein pieces to fit into this conglomerate. And so if you think of it from a chemistry standpoint, when this protein subunit, or when this protein subunit is bound to another drug, the drug is large enough to basically inhibit these two subunits from interacting and producing this functional 70S unit. And of course, this refers to prokaryotic DNA activity, which would be in contrast to eukaryotic ribosome drugs, which would be essentially chemotherapeutics for oncology. Here you can see the specific binding sequence of tetracycline. Okay, and so all the bacteria would have to do is to alter the codon 3 and substitute any of these letters for a different letter, and basically you could interfere with the ability of tetracycline to bind at this site. And so that same concept would be true for any of the drugs in this category. So let's talk about macrolides. And so macrolides are a subunit, or I'm sorry, a subcomponent of protein synthesis inhibitors. The prototype here is erythromycin, but also azithromycin and clarithromycin are all macrolides. These tend to be broad spectrum, and they tend to be bacteriostatic. However, when the concentration is increased, these drugs can become bactericidal. They offer a time-dependent activity, but they do offer minimal CNS penetrance, indicating that these drugs may not be appropriate for something like meningitis. The mechanism of action is to inhibit the protein synthesis by targeting the 50S subunit. Major side effects to the macrolides include GI upset as well as an eye toxicity. The next group of antibiotics are the aminoglycosides, and the aminoglycosides include streptomycin, kanamycin, tobramycin, gentamicin, and neomycin. All these drugs are broad spectrum and mostly bactericidal. They do offer a time-dependent killing activity, but minimal CNS penetrance, as well as poor oral bioavailability, meaning that you can't really swallow these pills. You have to give them IV to get the maximal kind of effect. These drugs target protein synthesis by specifically binding to the 30S ribosomal subunit. The main side effects to aminoglycosides include a nephrotoxicity as well as a hearing or ear toxicity. So patients that have reduced renal health or renal failure may not be appropriately given an aminoglycoside, at least on the standard dose form. You may be able to get away with giving them an aminoglycoside with a reduced dose because they have a hard time clearing it because of that nephrotoxicity. Tetracyclines, the prototype here would be minocycline, tetracycline, doxycycline. These are all broad spectrum antibiotics. These are bacteriostatic more often than not, and they can be bactericidal when the concentration is increased. Like other drugs in the protein synthesis inhibition category, they do have relatively poor oral absorption, but they're still given orally. Here we can see an inhibition of protein synthesis targeting the 30S subunit, as well as blocking the binding of tRNA to the acceptor site. The main side effects to tetracycline include GI upset, sensitivity to light, bone discoloration, and deformities, and that also extends to teeth as well. And so there's a classic example of women who took a tetracycline during pregnancy, and then the child is born with really bad teeth and a reduction in enamel. Chloramphenicol is an interesting drug. From a chemical standpoint, it's very close to chemotherapy in terms of cancer chemotherapy. It's a really potent drug. This is a broad spectrum antibiotic that is usually bacteriostatic, but when you increase the dose appropriately, you can produce a bactericidal outcome. Chloramphenicol has excellent CNS penetrance, and so you can see it sometimes used with meningitis. It does inhibit protein synthesis by going after the 50S ribosomal subunit. The main side effects include GI upset, as well as bone marrow suppression. So this is why it kind of behaves like cancer chemotherapy, for oncology, because it does produce bone marrow suppression. And so there is a little bit of possible off-target binding outside of the bacterial subunits, and possibly some binding to the mammalian subunits of the ribosome as well. Chloramphenicol is also notoriously associated with gray baby syndrome. If this drug is given to neonates, they have a hard time excreting the drug, and so they take an ashen kind of gray color to their skin. Clindamycin is a gram-positive, is a drug specifically for gram-positive bacteria, usually bacteriostatic, and again, if you increase the dose, it can become bactericidal. Clindamycin is orally bioavailable. It can also be given IV. It does offer minimal CNS penetrance. This is one of those drugs that targets the 50S ribosomal subunit, and from a chemistry standpoint, it binds in relatively close proximity to macrolides. If you do decide to co-administer these drugs, there may be some competitive inhibition because the two binding sites are very close to each other, and the chemicals themselves, the antibiotics themselves, may be quite large, and so they, from a chemistry standpoint, they may not fit on the same molecular target if given at the same time. The main side effect with clindamycin is GI upset. And so in terms of looking at all of the drugs that can effectively target protein synthesis, this is a nice summary slide. Here you've got aminoglycosides, tetracyclines, and streptogranins. Aminoglycosides, tetracyclines binding to the 30S subunit. And here you have streptogranins, oxazolinidones, lincosamides, chloramphenicol, and macrolides binding to the 50S subunit. And so, and if any of these drugs are given, they're going to reduce the activity of protein synthesis, and the bacteria are going to eventually die. There's a subset of drugs that are deemed inhibitors of DNA damage and repair, and this will be the context of the next lecture.